ATI is where? In the ATI book.
Yeah, just be able to go through all these chapters.
The rationalization, right?
Yeah.
And practice all those.
Practice all those questions. But FYI, I send you that one to Mr. B and to Mr. James, and then you just work it together. It's not the leakage. It's like an overview how the ATI asks the question. They have a different form. They have an A, B, C, D, E, F, G, H, I, J, K, L, M, N. Okay? So are you following me? So there's a lot. It so happened that I told you I work in the management position. I can print that time. But right now, I cannot do that. Okay? But before I have an access, I can print everything. Because actually, my HESI, I left my HESI, question bank before, on my old job. But that's fine. So I will give you a topics to review. Okay? So, and then, this is the secret of ATI. You have to go through to the ATI ebook. One down. Okay, what is the second step? Once you go through to the ATI book, what is the second?
Start doing the questions.
Start doing the question.
Yep.
It should be what? It should be done. If I were you, it should be done Sunday. Ebook question. If you have an opportunity, do it Sunday, Monday. Why? Because I have another step for you. What will be the second step? The second step will be what? You have to repeat again the ebook and then do the question again. Because if you will not, undergo that one, what will happen? Uncooked rice. I mean, not really, it's a seesaw. It's a seesaw, right? Seesaw. Your answer and your result will be seesaw. It should be complete. Okay? Are you following me? So right now, where are you right now in your ebook? Okay, Miss Patel, do you have the ebook material? Ebook. Ebook, Miss Patel?
Yep.
Okay. Did you go over with the ebook?
Yes.
Okay, that is the first thing to do. You have to go over with the ebook. Word for word, page per page. Okay? So where are you right now? So Mr. B, if you don't mind, can you share again the ebook? Okay. While waiting, how about you, Miss Mubi? Where are you in the ebook? Permission. Okay. Miss Mubu, where are you right now in your reading?
GI. I'm on GI.
Oh, GI. Okay, GI. All right. How about Miss Melissa?
Same thing. I'm also in GI because that's kind of long.
What time, Miss Lynn? Can you please send a link to Miss Lynn? She's asking what time is
Yeah, I'll send it. I'll send it.
Okay, next, Miss Melissa.
I'm also in GI.
Okay, so pretty much when you're telling me you are in GI, you're done with what? The beginning.
The beginning. The
emergency.
The introduction.
Endocrine.
Yeah.
Endocrine, okay?
Pathology, yeah.
Okay, this is my question to you. Did you go over word for word, page per page?
Yes.
Yes.
Word
We
for word,
also
huh?
practice the 5 questions.
Okay, very good, very good. Okay, how about Mr. Alex and Mika? Where are you?
We are starting Unit 11, which is intergovernmental disorders.
Skin.
Yes.
Is that the skin? Okay, but what topic did you finish?
We finished. No, I'm sorry. GI. That's the one that we finished hematologic.
That's
we
good.
Finished electrolytes.
Range
neurological disorders and adults. We're done with that one.
Okay, there you go. Thank you. Thank you. At least, right? I'm very happy that you're finishing something. Okay, very good. Because if not, I mean, I'm telling you, the secret of ATI, it's in the ATI book. Okay, Mr. Alvaro?
Yes. So I was checking I was done with the neurologic chapters.
Okay.
Mm.
And then what else?
And I did already the a little bit of the review of what is Parkinson, Alzheimer, on all those chapters.
Okay, very good.
Mhm.
So, but again, make sure you are not doing all over the place, right? Okay, it should be everything. Okay, that is the first step right now. The second step is very easy. The question and answer is easy. But the first step is the hard one. Okay, thank you. How about you, Miss Cherie?
I'm doing the endocrine system.
Okay, endocrine.
Yeah,
But
yeah.
what topic did you finish?
The GI, I'm doing the GI system.
Okay,
Everything?
everything?
Everything now. Long.
Okay, so that's fine. That's fine. Okay, but again, take note. Okay, how about you, Miss Joyce? Oh, Joyce, welcome. Right, welcome, Miss Joyce.
Yeah.
Okay, so the first thing to do for Miss Patel and Miss Joyce, okay, is you have to go over with the ebook. Do you have an ebook?
Yeah.
Okay, that's the first. Nothing I can do with the ATI. If it is a HESI, you know, HESI, I can tell you just read the Saunders book. But ATI, this is like a what? They are hiring people just to change the question. They have a lot of version A, B, C, D, E, F, G, H, I, J, K, L, M, N. I'm telling you. Okay? They are hiring people for what? To change the question for ATI. The secret is inside the ATI book. Okay? So for Miss Joyce and Patel, I want you to go over with the ebook. Okay? So are we good? The two of you? Okay, thank you. Mr. J?
Yeah.
Okay. What did you finish or what are you doing right now?
I did 1 and 2, and then I'm looking at all the diseases. I'm
Okay.
on respiratory right now.
Respiratory. Okay. So I'm hoping that up to Sunday or Monday, you're done.
Yep.
Okay?
Mm-hmm.
Because we're running out of time. Even me, I'm very what? I'm very anxious too with this group, right? Because I need to what? I need to tell you, you need to finish up to Monday. Okay? So next, thank you, Mr. J. Yadira, Miss Yadira.
Yes. Actually, already in chapter 3 with the neurologic.
Mm-hmm.
I've done 1 and 2. I should be done with 3 today and moving forward.
Okay, thank you. Moving forward. Congratulations. Miss Charmaine?
Yes.
Okay, go ahead. Where are you?
I've only just got into GI.
Okay, but you're done with the previous?
Yes.
Okay. Yes. All right. Okay. Thank you. So make sure, make sure. Okay. How about Mr. James? Where are you right now in reading part?
I'm starting the electrolytes now. So.
But
what
topic did you finish?
I finished the one for chapter 35.
Mm-hmm.
And actually, I started doing the presentation thing. So I kind of like flipped, after I did that one. So
okay, that's good. So that's the first one. Okay.
Yeah.
Thank you, Mr. James. How about you, Mr. B?
I don't know why.
Okay. Thank you. Okay. So just keep going. Okay. Keep going. Miss Joyce, where are you? What are you doing right now for the ATI? I don't know your background, but can you tell me what are you doing?
Yeah, I'm still like reviewing more of them, like with randomly, but yeah, I'm going set for the renal.
Oh, renal. Okay, renal. So just follow my instruction, okay? So if you're done with whatever step, so at least you are aware what's going on. Okay, thank you, Miss Joyce. How about you, Miss Patel? What are you doing right now?
I'm reading the book and I also practicing the practice A and B on the ATI.
On the ATI.
So, yeah.
Mm-hmm. Okay. Okay. All right. So the first step, write it down in your notes. So this one, the unit 1, right? This is foundation of nursing care. So you can read this one at the end. Okay? So, but if you have a time, you can read maybe later. But the most important, I want you to finish the reading up to what? Maybe up to again, some of you are working, that is fine. Adjust the time according to your schedule. So maybe up to Friday, you're done with the reading. Okay, reading. So this one, maybe later, after what? After we're done, you can read the foundation of nursing. Okay, next, go down, Mr. B. So the next one, I know that some of you done with the neurosensory, right? So write it down in your notes, done neurosensory. Okay, done neurosensory. Okay, now next, I know some of you are done with the respiratory. If you're not done, you have to take note in your what? In your notebook. Okay, I'm not done. Okay, next, go down, Mr. B. Some of you are done with cardio, right? Reading cardiovascular, right? Yes or no?
Yes.
Okay. And then some of you are done with what? Hematology, right?
Yeah.
Okay, hematology. Very good. So that is the blood. Okay, down. And then electrolytes. Okay, and then GI. And then GU. And then, of course, the reproductive. Okay? So reproductive. Reproductive, just give your 1 to 2 hours for reproductive or 1 hour. Okay? Not really, you know, the main disorder. Musculoskeletal. Okay, add musculoskeletal. And skin. Skin. And then after the skin, I think endocrine system. Endocrine. And then after endocrine is immunity. Right? Immunity. Now, you decide right now. So since I'm done with some of them, so I will just deal with the topic that I'm not done. Okay? Which is the skin, which is the immunity, which is reproductive, and cancer.
Sorry,
Right?
Mr. J. Which one
Yeah.
is GU?
Huh?
GU. What
GU is urinary.
Renal.
Oh.
Renal.
Oh.
Renal. At the unit 8. Okay? So, are you following me?
Yeah.
Some of you, you're done with respi, cardio, you know. So right now, you have to read the material. Up to tomorrow or Saturday. Okay? Do not do the question yet. You can do the question, the 5, you know, the 5, how many questions, Miss Cordero, Miss Charmaine?
Like 5
Five
questions.
at the end of
Okay.
each chapter.
You can do that one. That's fine. Okay? But the most important, at least up to Sunday or up to Saturday. Saturday, you're done with the ebook. Ebook first. Word for word. Page per page. Okay? Are we good?
Yes.
Okay, now, after that one, right? Go to the question bank. Maybe Saturday, Sunday. Okay, can you go to this question bank? Okay, you have to go over the first thing that I want you to do is the A and B first. Can you go to the A and B?
Yeah.
Yeah, because a lot of questions are there in the A and B. A and B. First. How many questions is that? A and
90.
B.
90 questions.
Okay, 90.
90.
This is what you're gonna do. Tomorrow night, so that I can monitor your ATI. Tomorrow night, you have to send it to me, the A and the B. Okay? Tomorrow night. Or up to Saturday, the A and the B. Okay? A and B. Same thing that I did on the day class. They are sending me the what? The ATI. Okay? A and B. A and B. Right now, on Monday, we will start the maternity. Okay? They survive with what? Psych now. Okay? So I'm very, very happy. Yeah, I'm very happy for the day class because they survive a lot of ATI right now. Okay? So you will survive too. So just listen to me carefully. Friday night, make sure up to Saturday morning, the A and the B. Okay? So now, don't just send it to me, the A and the B. Another tip, a lot of question in the ATI, the actual ATI, the answer is in the rationalization. Right? So once you do the A and you have 50%, okay, remediate. What is remediation? Read the rationalization word for word, page per page. Okay? And then as much as possible, redo it. Do not give me a 50%. You have to give me a 70%. Okay? Are we good?
Yes.
Okay? Okay, that's it. What will you do? I have a 40% for the first try. Okay, it doesn't matter. It doesn't measure on that scenario if you have 20, 30. Okay? So what I want you to do, go over, do the focus review, read the rationalization word for word, page per page, and redo it. And then send me a 70%. Okay? Are you following me?
Yes.
Same thing with the B. So I need the A and B. I think Mr. Alex and Mika, can you do that? Friday or Saturday morning? Or are you working Saturday, Sunday?
We work 16 hours, so we don't get home. So we get to work 6 a.m. to 10 p.m.
Okay, and what day?
Saturday and Sunday.
Okay, so can you do in advance Friday?
But see, because you said we have to read GI, reproductive, musculoskeletal, skin, and endocrine.
Okay, you can do Monday.
Okay.
So
Monday.
So you want us to send the A and B on Monday?
Yeah, Monday. Monday, maybe afternoon, not in the morning.
Okay.
Okay.
Not in the morning because you're tired in the morning. Okay, I know the 16 hours. I've been there than that. Okay, the 16 hours. I have a back pain, right? Okay. So maybe in the afternoon. Is that okay with you, the two of you?
Yeah. Is that the only thing you want us to send you? Because I know you said something about like 200 questions.
Yeah. Okay, we will go on that side. I want you to do first this one.
Okay.
Okay? But only for the two of you. Okay? Because you are working. I excuse you. Right? And then, but for the others, you have to send it to me on Saturday. A and B. Okay? I'm so sorry. Right? Because A and B. I'm so sorry. We have to do it. Okay? Do you want me to coach you? I will coach you. A and B. You can do it. Okay? Positive energy. Maybe about Saturday afternoon. That's fine. Saturday afternoon. After reading the material. Okay, next. Next one.
Miss Mary Jane, before you go, there's a part in the ATI that says learning system PN 3.0, and they have all these questions like medical, surgical, endocrine. Should we do those questions?
We will do after that. Because according to the feedback, there's a lot for A and B. Okay, A and B first. So, and then you have to go through with the rationalization. Okay, so we're good? Okay, second, next one, Q&A. Go to the bank, to the quiz bank. How many quiz bank you have for the medical surgical? Go to the quiz bank. Okay. For the quiz bank, you have to go through with all of this. How many questions is this? 590. Now you divide. Okay? You divide, maybe it's up to you how you will divide. Maybe on what? On Monday, you do this one, medical surgical hematology. And then make sure up to Wednesday next week, you're done with everything. Yeah, because I have another step.
Monday.
Or else it will be uncooked. Okay? So this one you have to be done. So you divide. Can you help me to divide?
And
This
we're
part.
starting on Monday. 3, 4, 5, 6, 7, 8.
Okay, you divide that one. Wednesday only, cut off. Cut off. Because July 13 is your test, right? Cut off. Cut off.
July 2. Monday. Monday. Tuesday. Wednesday. You have to be four for one day, and then take the other days.
So
Actually,
up
6
to
and
July
2.
8. Because 1, 2, 3. My goodness.
How many days?
50 days.
My calendar. 6 days, right?
Okay, up to July 8. Make sure everybody.
Like 100.
Yeah, 100 every day. That's
Yeah,
nothing.
100 every day.
Okay, 100 every day. So you have to send it to me. Make sure 70%. I will not accept the what? The 40, 50. What will you do after you have a 50%? What will you do? Redo it.
Yep.
Retake it.
Right? Yeah,
Retake
retake it. So do not email me. It's hard. It's a long process. I know. but what do you want me to do? I want you to pass. Okay? Actually, I'm not, for this one, is what? The ATI is very hard to battle. A lot in the other school, sometimes in the exit, only one pass, even they are born here. You know, I'm dealing this one before. We have 35 people, only one pass. But they are born here, meaning to say English is the first language. Right? Why? Because of the misredirection. There's a technique of ATI. Okay, so we're good? Yes
sorry,
or no?
Okay, I just wanted to clarify. You want
Yes.
all of these specific shaded questions to be done by Wednesday?
Okay, this is the thing. Up to Wednesday, July 8, you divide. Okay, after done with A and B, you're done maybe on Saturday. You know, you have a Sunday. I know it's 4th of July. I understand that. Barbecue, barbecue. But you can what? Okay, you can celebrate the rest of your 4th of July next year. Okay, once you graduate, celebrate next year. You do the barbecue thing. Okay, now you start on Sunday, Monday, Tuesday, Wednesday. I can help you. Maybe you do the cardio and hema Sunday. Maybe dermatology, endocrine, and then GI Monday. For Alex and Mika, you just adjust, okay? And then you do the immune, musculo, maybe Tuesday. Okay? Add another one, oncology, because oncology is not really, you know, like a big deal. And then the rest, sensory, urinary, and respy, Wednesday. You divide. Okay? So, okay, I can divide it for you. I can divide it for you.
Oh, no, you don't have to. I got it.
You got it?
Yeah,
Okay.
I got it.
Okay.
Wait, I have to be right back. Someone's at the door.
But Miss Mary Jane, do we have anything to do with the first adult medical surgical 587 questions?
What's that?
Yeah,
it's
that's
together?
all of it together.
587?
Yeah.
Okay, thank you.
Alright, good. So what will you do? You have to send it to me and you have to what? You have to type that this is the GI and dermatology. This is what IMU and this one. Okay, we're good. So you adjust. So whatever you want. If you want to combine cardio and dermatology, because you feel this is easy, that's fine with me. If you want endocrine, GI, and immunity, that's fine. Musculo, neuro, as long as you do it, I'm okay. As long as you finish this one, because we have a third step.
Okay.
Okay? So we're good.
Okay.
What is the third step? Write it down. Up to Wednesday, July 8, you have remaining what? You have remaining how many days? 1, 2, yeah, 5. 5. Okay? So for the 5 days, on July 9, I want you to redo the A and B again. The question. A and B question. Actually, no. July 9, I'm sorry. I want you to redo the 1-day ebook review. July 9. Okay? Because you need to do, I know that. Okay? It should be sync here. Okay? So 9, just pass by everything. Chuk, 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 chuk. For 1 day, July 9. Okay, 10. On July 10, I want you to do the A and B. A and B on 1 day. You're doing a redo. You're just doing a redo. So meaning to say, answer question, answer question, answer question. Okay? And then 11 and 12, you do this one. You do this one. If I were you, no, change. Again, one more time. July 9 ebook. Okay, change. July 10, 11, this one. 10, 11.
Okay.
Okay? And then 12, A and B.
10, 11.
Alright, so are we good?
Hold on, what is 10, 11?
Wait, we said July 10 and 11. Which ones are we gonna do?
These
Same one.
Medical, surgical.
10 and 11.
What?
The 500 and something questions?
Yeah, the 500. You're just
587.
redoing. You're just
okay.
doing the review. Question, answer, question and answer, question and answer. Okay? 10, 11, and then 12, A and B. Okay? Maybe it's enough. Okay, so we're good. Okay, next. Next one, I'll give you the topic. Okay, are you ready?
Yes.
Before I go over with the ebook, I will give you a topic right now. Okay, so number 1 topic.
Abimo.
So I think this is 90 question, right? 90 question, and it covers a different topic. Okay, listen carefully. Okay, because I want to give all the topic right now. So I want your cooperation. Please listen carefully and be independent. Not all the time that your classmate will help you. Okay, because I'm telling you, I'm just, I'm very, very observant. Your classmate is very helpful to you. But I want you to be an independent person. Okay? Because when you will work in the nursing arena, your classmates are not there anymore to text you, to inform you what's going on. Are you following me? I want you to be independent because I noticed that you are repeating the question every time in WhatsApp. What is the time today? Oh my God. You have to be independent. Don't get me wrong. Okay? Don't get me wrong. Okay? I want you to be independent. I need to catch you right now. Because in the nursing arena, the one who will catch you is what? The termination letter. Okay? The one that will catch you what? Is the write-up. All right? Right now, right now, be thankful. At least, me is the one who will what? Catching your what? Your mistake. Are you following me? Because as a teacher, I'm your mother. Some of you are older than me. That's fine. But right now, I'm your mother. Okay? In the nursing arena. Okay? I'm telling you, nobody will help you in the what? If you commit a mistake on that one, right? The one you will receive what? A write-up or a termination letter. Or, if you're repeating the information with the doctor will check. And then the next day, what? There is a gossip. There's one nurse that don't know anything. One nurse that don't know how to what? To get the order. One nurse that repeating the what? Repeating and cannot get it. I'm telling you right now, don't get me wrong, but that is the reality, right, Miss Mubo? Right? In the real world, right?
We have one at my job. I don't know. I don't know, nurse.
Okay, so right?
In the
I'm telling
real
you.
world, you will be by yourself. Yes,
There
we know
you
that.
go, Miss
Yeah, it's
Lee.
good to be
You will
independent.
know
be
that.
by yourself.
That's right.
I'm
Thank
telling
you,
you.
classmate.
Okay, there you go. You will be by yourself. Okay, I'm telling you.
Yes.
Because before my job, I'm a supervisor before, and I'm following up every day. You know the chart. And then, you know, every day after the duty, I'm following up one LPN all the time. Okay, I'm opening all the chart because I know there is a mistake. Right? I know. I'll be in trouble. And then I have a what? I have an eyes, ears. You know, I know what's going on. Somebody will call me. There's a medication error. So I will there. Oh, what's going on? There's a medication error. It's not about me. You know, because it's not about that I'm what? It's not about that I'm following you. It's all about what? It's all about patient's life. It's not about you. It's not about that I'm what? I'm picking on you. No. It's about the patient's life. Okay? Are we good? Yes or no? I want you to be independent like what I did in the day class. Yeah? I'm very independent with them. Okay? So that's why I'm very happy too. Why? Because right now we are in the last phase, maternity and peds. Yeah, they're almost done. When I accept them, they are in med-surg too. During the COVID-19. Same thing with the clinical with you, right? Same thing with the clinical. So meaning to say, you will be successful too.
Amen.
Okay? Amen, right? Okay.
Yes.
But in ATI, you have only what? How many chance, Mr. B?
Well, I think
3.
Okay, 3. Now,
Three.
if you didn't pass the 3, I mean, you will not move forward to the site. Okay? So we're good? So just to let you know, yeah, even in the day class, you know, I'm telling them sometimes, but they are very sport, you know. You, Mr. Blah 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 blah, or Miss blah 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 blah, right? You have to what? Too much work, so you have to what? You have to do the ATI. Okay, I don't want you to pay. So right now, I'm telling you, once you fail the ATI on the 3rd time, you cannot move forward. All right? But don't be afraid. Everything is possible. Okay? So just listen to me and be an independent one. Okay? So I will apply you my style in what? In the other school. This one. But they are successful. I just lie low in your class because 27. I don't want to stress myself. Okay? So clear.
Yeah.
But right now, since that the original are here, 13 to 14 people, okay, we're good to go. Okay, let's do it. Number 1. Okay, letter A. Letter A, coordinated care. 2 items. Letter A, 2 items. The question will be establishing priority. Okay? So the first question for the 2 items is fluid and electrolyte imbalances. Okay? So what is your idea with electrolyte imbalances? So let's do the review. Okay, what is the normal value? Mr. B, can I type? Thank you very much, Mr. B. Yeah, cancel. Thank you. Okay, write it down. So let's do the review. Okay, potassium. Okay, potassium is 3.5 to
Sorry to
5
interrupt,
point.
Mary Jane. I think
What's that?
Joyce is trying to get in. I don't know if she.
Who?
Joyce. She got her computer. She had computer problems.
Oh, I cannot see her right now.
Yeah, she said her computer shut down. I'm trying to get in again.
Okay, just tell her to go back again.
Okay.
And then I can once she's in, see waiting room, so I can admit her again. Okay, so we're good? Okay, number one.
Sorry.
So I will be a little bit fast at this time, because I need to cover a lot of scenario. Okay, one is electrolytes, right? Okay, electrolytes. So, okay, hold on. Clear first. Okay, electrolytes. So the question is, you need to know the common electrolytes normal value. So potassium, 3.5.
5.5.
5.
5.0.
5 point what? 0.
0.
Okay. So again, some of you, you know 5.1, 5.0, it doesn't matter. I will not interfere. Okay, sodium is 135 to 145.
45.
Very good. Okay, next. Next one is calcium. Hold on.
8.4 to
Calcium
10.6.
is what?
8.4 to 10.6.
Very good. Or we can do like 9 to 11. Again,
Okay.
you don't dig this one. If you know something, that's fine with me. Right? I will not interfere. Okay. Next one. What else? Cholesterol. Right? What is the normal value of cholesterol? Less than
200.
200. Very good. 200. This is a normal value. Okay, next. What else? Triglyceride. Triglyceride, what is the normal value of triglyceride? Less than 50. Less than 50.
50.
Okay? Very good. Next. Next normal value, hemoglobin A1C. Hemoglobin A1C. Okay? Less than what? Less than 7. Okay? Or 6. They want
5.
low. Low. Okay? Less than 7 or low. Okay? Or low. Okay, next. Aside from that, normal value of RBC. What is the normal value of RBC?
It's 15.
What is the normal value of RBC?
15.
Is it 10 to 10?
3.2 to 5.2.
Okay, 3.2 to
5.2.
5.2 million, right?
Yep.
Yes or no? Okay, next. Let's go to the WBC. WBC 5,000.
10,000.
Okay, to 10,000. Okay, very good. Next, platelet. Platelet is 150,000.
400,000.
Very good, to 400.
5,000.
Okay, in the other book, 150 to 450 or 200 to 400. It doesn't matter. They will give you 50,000 anyway. Significantly what? Significant bleeding. Okay, so are we good? Yes or no? Okay, next proceed. Okay, next one. pH. pH 3.5 to what? 7.35 to
7.45.
Okay.
7.45.
Okay, very good. Next one is pH. Next one is PCO2. PCO2, what is the PCO2?
35 to 45.
35 to 40.
Okay, you just X this one. X.
The 7.
Okay, 35 to
45.
45. Very good. Okay, next proceed. Bicarbonate 20 what?
22 to 26. 22 to 26.
22 to 20. There you go. Congratulations, Miss Mubo. Okay, next one. Next, pH. Specific gravity. I'm sorry. Specific gravity.
10 to 10. 28.
There you go. You remember. 10 to 10 30. Okay? So pretty much, you have to know this one by heart right now. Right now. Okay, right now. So next, the question for 2 points, coordinated, 2 items. Fluid and electrolyte prioritizing client. So meaning to say, maybe they will give you like a potassium. If they are giving you a potassium of 3.5 is normal, right? That's fine. But if they are giving you like 3.4, even 3.4, that is considered what? Reportable. Okay, follow up. Reportable. Okay, now, what to do? Immediate intervention. We have to give a potassium chloride now. Potassium chloride now. Potassium chloride now. Okay, are you following me? Now, 3.4. Now, if they are giving you like 3.0, right, very low, or 5.5, very high, monitor EKG or EKG monitoring because it can lead to cardiac arrest or arrhythmia. Are you following me? Arrhythmia. Okay? Are we good? So, fluid electrolyte imbalances, priority client. Okay, now, if they are giving you a sodium of 130, 132, right? Vomiting. The patient is what? Having a nausea and vomiting. This is priority because of the dehydration. All right? So again, the question for the first one, they will give you a fluid and electrolyte imbalances. Priority client. So maybe one of the question, they will give you like a number here. Okay, are we good?
Yes.
Okay, the second question in the two items, write it down. Alzheimer's disease, appropriate intervention. Okay, so the second part of the two items. Okay, so again, one more time. The two items, fluid and electrolyte imbalances, priority clients. Okay, the second question, Alzheimer's disease, appropriate nursing intervention. How to intervene an Alzheimer's disease? Anybody from the class? Okay, how to intervene the Alzheimer's disease?
Stay on a routine.
Very good. Stay on the routine. There you go, Miss Lynn. And what else? Familiarization. Familiar. Mr. Smith, this is your room. This is your room, Mr. Smith, with a yellow curtain, with a yellow ribbon. Okay? Are we good? So, the question here, appropriate nursing intervention and more on safety. Safety. Okay? Very good. So, the first question is two items. Okay? So, are we good, my dear? Yes or no?
Yes.
Fluid and electrolyte and Alzheimer's disease, two items. Okay, that's letter A. Okay, the question is establishing priority. Okay, second question. Let's go to infection control. Oh, okay. There's a lot of question in infection control. All right. So, safety and infection control, that's letter B category. Letter B category, safety and infection control. Under safety and infection control, letter A, accident prevention, 3 items. Accident prevention, 3 items. Again, we are in the letter B category, right?
Yep.
Safety and infection. So the total number of question is 10 items. Okay, 10 items. What are the question? So let's do it. The 3 items is about how to prevent error or injury. Okay, write it down. How to prevent error or injury. So the number 1 is Lobinox. The question about Lobinox. What is the contraindication of enoxaparin or Lobinox? What is Lobinox? Lobinox is the anticoagulant. Lobenox. Write it down. Contraindication of Lobinox. Can you give me the answer?
Vitamin K.
What's that?
Vitamin K.
Oh, there you go. Okay, antidote is vitamin K. That's the antidote. That is the antidote. Contraindicated for Lobinox. What is the contraindicated for Lobinox? Anybody from you?
No heparin, right?
Yeah, no heparin. Lobinox is also what? It's also like a heparin. Right? Lobinox is given sub-Q.
Maybe no aspirin?
No aspirin. No aspirin. Very good. Because they have a what? They have the same, right? Very good. Sub-Q2. Sub-Q and then aspirin. All right? So are we good? Lobinox is a what? Anticoagulant. So they are asking you what is the contraindicated or what is the what? What is the Lobinox?
They're risk
Okay?
of bleeding.
What is that?
They're on risk of bleeding.
Okay, bleeding is the magic word. All right, so very good. This is the question. Okay, next one. Let's do the anti-coagulant. Write it down. Coumadin. What is the antidote? Vitamin K. Or what is the other name? Aquamepython. All right. Next, heparin.
Heparin is a protamine
Very good. Heparin is
sulfate.
The antidote is what? Protamine sulfate.
Protamine sulfate.
Okay, very good. Now, what to monitor? Let's do it again. What to monitor for Coumadin? PTINR. Memorize that one. What to monitor in heparin? PTT. Okay.
PTT.
Okay, so very good. Yes or no? Here. All right. Next one. So they are asking you how to prepare for cerebral angiogram. Okay. Next question. How to prepare cerebral angiogram? You remember the magic pipe that I told you in general that you have to what? You have to get a consent, right? You have to what? You have to instruct them to undergo NPO, nothing by mouth, to 6 to 8 hours. Okay? Next, number 3, angiogram, gram. Check allergies. Okay, next, number 4. Number 4, after checking allergy, check vital sign. After checking the vital sign, okay, of course, health teaching. So pretty much for the angiogram, I will pick the check allergies. Okay? If there's no check allergy, maybe you can pick either the consent or the NPO. All right? Are we good? Yes or no? Okay, and the next one, caring for a client with anaphylaxis. How to care with a client with anaphylaxis? How to care with a client with anaphylaxis? How to care with a client with anaphylaxis? Anybody from you?
Epi? Do you inject epi?
Okay, epinephrine, right? Epinephrine. Emergency. So this is a 911. Anaphylaxis is an airway problem. It's an allergy reaction and an airway problem. Airway. So epinephrine. So that is the immediate what? Immediate drug that you need to administer. Okay, epi. So are we good? Yes or no? If there is no epi, what is the second option?
Antihistamine.
Antihistamine. Just in case there's no epinephrine, antihistamine. Okay, are we good? Yes or no?
Yeah.
Okay, next, proceed. So pretty much, that is the first 3 items under safety and infection control. Okay, letter B, tuberculosis. A caring for a client to have a BCG vaccine. Can I erase this one?
Yes.
Okay, let's go to the TB, BCG. BCG. Again, we call it man-to test. Maybe they will ask you the what? The result, 0 to 3 millimeter negative. Okay, next, 5 millimeter if you are taking care of a what? Of an AIDS or HIV patient. Okay, we're good? Okay, next, 10 to 15. 10 to 15 millimeter positive. I'm not saying you have a TB initial. But if you have a BCG, you don't need to undergo this one. What to do? Okay, chest x-ray. But how to confirm? How to confirm if you have a TB? Sputum test. Okay, we're good? Okay, again, chest x-ray is not a confirmatory. It's sputum test 3 times. Okay, we have to collect early in the morning because all the bacteria and parasite is there. Accumulation of everything. Okay, so BCG. BCG or man-to test, man-to test, man-to test. Initial test for TB. Okay, we're good? That is the 3 points. Oh my God, yeah. Okay, next point. Again, I will be a little bit, because there's a lot. We have to cover, there's a lot. Right now, I have 3 more pages. We are here. Okay, next. Next one. Alzheimer's disease, 1 point. Home safety. Again, how you will take care of a patient with Alzheimer's disease. We're talking about home safety. What is the answer?
Make sure there's a proper lighting, no rugs.
Make sure the entrances to the place are closed. All doors are closed.
Okay, that's it. Okay, it's all about home safety for Alzheimer's disease. 1 point. But again, not limited. I'm just doing the review to you. Okay, next proceed. Next proceed is, this is the big deal. This is a 5 items. This is a 5 items about transmission-based precaution. Can I clear this one?
Yes.
Okay, let's do it. Okay. Can I clear?
Yes.
Okay, next one, I'll be discussing the infection control.
Ya lo sabía.
Where is my... Okay, we're good? Okay, listen to me. This is very important. This is 5 items. This one can make or break you. 5 items. Some of the students, they are just missing 2 or 3. Right? So this is, listen carefully, infection control. Okay, infection control pretty much are the following. Let's do it. Number 1, 5 items. Okay, so I'll be discussing standard precaution. We have to treat everybody as infected. Okay, so pretty much standard precaution. We have to wear a gloves and also the hand washing for standard. Now they will ask you, what are the standard what? The standard, what are the standard disorder? The regular patient. The regular patient. Without what? Without infection. Okay, are we good? Okay, we went to the clinical, right? Okay, the one that they are not what? In? They are not in what? Isolation. Right? Okay, very good. So regular patient. Okay, example. Hepatitis. Example, B, C, D. Next, HIV, AIDS patient. Next one, Legionnaire's disease. This is a waterborne disease. Aside from the regular. Okay, next, Lyme disease. Okay, next one, just in case, Rocky Mountain spotted fever. Okay, next one is PCP. PCP is pneumonia exclusively for HIV. Okay, Kaposi sarcoma. Kaposi sarcoma is like a skin disease exclusively only for HIV patient. Okay, toxoplasmosis from cat, toxoplasmosis. Okay, aside from the regular patient. Okay, we're good? Write it down. You need this one not only for ATI but also in the future. Okay, now, next one. Next one, let's go to the three. Three isolation. Okay, we have letter A, we have airborne. Airborne is what? N95 mask is the PPE. N95 mask. Okay? So what is the difference between N95 mask and surgical mask?
N95, I think
The N95 has to be fitted.
Okay, very good. And what else, Miss Lynn? You are what? How many % you are protected?
95.
There you go. Congratulations. 95. Okay? So now, N95 mask, if you're growing to transfer the patient from one room to another, instruct the patient to wear a surgical mask. A surgical mask. Okay? Are we good? Yes or no?
Sorry.
If you're going to transfer, transfer. For example, TB patient, you will transfer from one room to another. Okay, Mr. Smith, you have to wear a what? A surgical mask. But for the RN or the nurse, you have to wear what? N95 mask. Okay, are we good? Yes or no? Okay?
Yes.
So this is the common question. Now, the next question. Close the door. Close the door. Close the door. Private room. Okay, we're good? Okay, next one. Another one. They will ask you about the disorder TB, tuberculosis, measles, or rubiola. No. Spelling. Rubiola. And then measles. This is measles, not meals. Measles. Okay. So measles or rubiola. Okay. Letter M. And then the third one is varicella. Varicella or chicken pox. Okay. Now, next proceed. After this one, they will ask you about the shingles. Shingles is a dormant of chicken pox. Meaning to say, 10 years old, you have a what? You have a chicken pox, right? And then you are stressed with the ATI in Americare. So you will have what? You will have shingles. That's why don't be stressed. Okay, I've been there, done that. I went to the hospital twice because of the stress before when I was doing a home health, the documentation. So I don't want to do home health. Okay, the documentation. So shingles is a dormant of chicken pox. If they will ask you what is the precautionary measure of shingles, it's two: contact precaution and airborne. If the shingles is fresh, meaning to say new, moist, it's contact. But it's about to heal, it's airborne. But again, do not what? Do not be confused. They will ask you what are the two precautionary measures of shingles. The answer is contact and airborne.
Airborne.
Okay, we're good. This is for the airborne. Okay, next one. Let's go to the next one. Letter B, droplet. Droplet precaution. What is the PPE? The PPE will be a surgical mask. Okay. Surgical mask for who? Surgical mask, this is from the book. I know right now everybody needs to wear masks, right? But this is from the book. Surgical mask for who? For the nurse. Same thing, you will transfer a patient from one room to another. You have to instruct the patient to wear a surgical mask, right? The patient. Okay, next, what will be the door? Close the door. And then also a private. Okay, what will be the disorder under droplet? Pneumonia. Pneumonia, especially what? Especially the bacterial pneumonia. Some of the pneumonia is viral. They are not placing in the droplet. Okay, pneumonia, bacterial. How we prove it? Through laboratory tests. Pneumonia. Next, flu. Okay. Next, diphtheria. Okay. Next is epiglottitis. Okay. So that will be for the droplet. Okay. So next, the last but not the least is contact. Contact precaution is to what? So the contact precaution is to skin to skin contact, the mode of transmission. Skin to skin contact. Okay, we're good? Again, airborne, repeat. Airborne, mode of transmission, when you inhale it, you will have it. Airborne, mode of transmission, when you inhale it, you will have it. What type of room? Okay, what type of room? Private.
Private.
Okay, by the way, for the TB negative pressure. TB negative pressure.
Negative pressure.
Double door. Because once you inhale it, you will have it. Okay? So clear. Coronavirus, once you inhale it, you will have it. Okay? So airborne precaution. Letter B, droplet. Okay? So droplet is through sneezing, coughing, and talking. Because once you sneeze, it's in the air. Okay? So droplet, what will be the droplet? The droplet will be what? A surgical mask. A surgical mask. Okay, we're good. Letter C, contact precaution. Skin to skin contact. There's the three things. Mode of transmission. It can be skin. Write it down. Skin, what will be the disorder? Scabies or scabies? Wound infection. And of course, what is the third one? Impetigo or impetigo. Okay, impetigo or impetigo. It can be from what? From contaminated water or what? Contaminated food. Or we call it enteric. Okay, so what will be the what? What will be the disorder? The disorder will be hepatitis A. A. Okay, it can be salmonella, waterborne. It can be E. coli. Okay, it can be salmonella, E. coli, and then it can be Shigella. All right. Okay, next, the third one is from resistance. From what? From medication, MRSA. Methicillin resistant Staphylococcus aureus. BRE. Vancomycin resistant enterococci. Okay? So, that's it for the infection control. Contact, gown, and gloves. Are we good? Okay, memorize this one by heart. So not only for ATI, but knowledge is power. Okay, this is the question. Then question for this one is 7 points. Okay, write it down. They are asking the precautionary measure of hepatitis A. What is the precautionary measure of hepatitis A? Can you answer me?
Wear gown and gloves, right?
Gown and gloves.
Okay, and then
Contact.
what is the Answer. Precautionary measure.
Skin to skin.
Skin to skin is contact.
Contact.
Contact. Okay? Contact
Protect
precaution.
precautions with hepatitis A.
I think it's gone.
Okay. All right. Next question. Next question. What is the precautionary measure for TB, tuberculosis?
For TV,
Tuberculosis.
Mask and
TB.
gloves.
Mask.
Airborne
N95.
N95 for the
N95 mask.
Negative.
And negative pressure room.
Negative pressure.
Yeah.
Okay, very good. Okay.
Private.
Next, private room. Okay, next one. Next one. Third question. How you will take care of a MRSA patient? MRSA patient.
Gloves.
Gloves, gown and mask.
Gloves.
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 So hit your leg against the toilet like I did.
Oh,
it's contact.
Okay, contact.
Gown,
MRSA.
gloves, and mask.
No, GG only.
No, man.
Only GG, gloves and
GG.
gown.
GG.
No marks for contact.
Okay, right now.
Okay,
I
MRSA,
know
MRSA, MRSA.
MRSA. CD. This one, CD.
Everybody knows
Clostridium difficile is infectious diarrhea. Okay? Okay, MRSA. MRSA BRE. All right, we're good?
Okay, gown and gloves.
We're good?
Yeah.
Okay, next topic. Next question. What is toxoplasmosis? What is the transmission of, you see? Transmission of toxoplasmosis is from cats. From cats. That's the answer. From cats. Okay, next one. What is healthcare associated infection? What is the healthcare?
Nosocomial.
Nosocomial from the hospital. Right? For example, they admitted you for pneumonia. All of a sudden, you have an UTI the next day. So the nosocomial infection is what? Is the UTI. Very good. All right? Because of the infection control. Next one. Next, intervention for a client with unexpected WBC count. Can I erase this one?
Yes.
Okay, let's do it. I will be a little bit fast because there's a lot of question, huh? Okay, the WBC. It's recorded anyway. So the WBC is 5,000 to 10,000. Okay. If greater than 5,000, sometimes ATI love to give you a data. Okay? They will give you maybe about 13,000. ATI love, okay? The typical ATI question, they love to give a data. Take note, read the rationalization because some of the question is in the rationalization. I'm telling you right now, okay? So they will give you about 13,000. So what will you do if you have a data of 13,000 infection? Okay, what will you do with the infection? Check temperature. We can what? We can administer. What to administer? Tylenol. Administer what again? Tylenol.
Tylenol.
Administer Tylenol. Okay? Administer Tylenol for fever. And then, of course, rest. Of course, rest. Encourage for rest. And then also, if you know the sponge bath, right? The sponge, the TSB. You know the sponge bath, right?
Yeah.
And culture and sensitivity test.
There you go. That's what I was looking for.
TBT. Okay, we're good for the 13,000. Now, this is another favorite question. They will give you lower than what? Lower than?
5,000.
Okay, they will give you 3,000. Okay? 3,000 is immunocompromised patient. How to take care of immunocompromised patient? No to fresh flowers. No to what? No to
Pouch.
No to what? Raw food. Very
Raw
good.
food.
So meaning to say, you
No
cannot
sushi.
eat your favorite what? Sushi.
Sushi.
Okay, that's my favorite. But you know what? In the Philippines, I saw in Facebook, they are baking it. Right? They are baking the
Sushi bake.
sushi.
Oh my God.
Right? Okay, they are baking the sushi. Okay, next one. No raw foods. Okay, how about my favorite? Medium well done. Steak.
Steak.
No.
Steak.
No.
red
No.
meat.
No.
It needs to be
No,
fully
no,
cooked.
no. Okay? And then
Well
you know
done.
what? I cannot what? I cannot eat my favorite salad bar.
No
No to
salad.
Olive Garden. Right? No fresh foods. Okay? No live plants.
No gardening.
No, there you go.
No
No
crowd.
activity.
No
No
crowd.
crowd area. I know that mall right now is open. No crowd area. Okay, no crowd area. So what else? No gardening. Okay? Regarding activities that you will be exposed to what? To the infection. Next, no to no tap water. Instead, of course, the bottled water. Okay, so very good. So this is the question, intervention for a client with a low WBC count. Okay, this is what you're gonna do. Okay, can you repeat? Miss Maria, how you will take care of your patient if the patient has 3,000 WBC, or we call it neutropenia. Neutropenia. Go ahead.
No fresh flowers, no raw foods,
Mm-hmm.
and no gardening,
Okay.
no crowded.
No crowded area. Okay. So very good. So that will be the 10 points, my dear. This is a big deal. The safety and infection control, 10 points. Okay, you know what to do. 10 points, right? This is a big deal. 10 points, 10 points, 10 points. Okay, next topic. So 7 items. Health promotion and maintenance. Okay, the topic called health promotion and maintenance. Okay, so the first question, 7 items. 7 items is skin cancer. How to report or findings report for the skin cancer. If they're asking you the findings, findings is the signs and symptoms. Okay, so help me. What are the signs and symptoms for a skin cancer? 7
Irregular
items.
border.
One. What's that?
Irregular border.
What is that again?
Irregular border on the skin.
Okay, regular border of the skin. What else?
Unhealed wound.
What is that?
Wound that cannot heal.
Okay, the wound that cannot heal. Very good. But again, it's particular with the skin cancer. 1 point. Okay, we're good. Okay, next question. 7 items. Next question, risk factor for glaucoma. What is the risk factor for glaucoma?
High blood
Glaucoma.
pressure. High blood pressure.
Glaucoma is what? High blood
High blood pressure.
pressure.
Diabetes.
Okay, diabetes. Glaucoma. Glaucoma, usually intraocular pressure. Okay, more on the hypertension, high blood pressure. Okay, we're good? So the patient will complain of severe eye pain. All right, next is screening for occult blood. Occult blood. Okay, instruct the patient. Occult blood, instruct the patient no to what? No red meat before the test. No red meat before the test and no ascorbic acid or vitamin C because it can give a false positive result. Okay, are we good? That's number 3. 7. Number 4. Colorectal cancer. Oh, they love cancer, ah. Colorectal cancer. Colon cancer. Colorectal cancer risk factor. So more on the diet. Okay? Colon, more on the diet. So colorectal cancer, diet. Right? I don't know if you know President Aquino back home in the Philippines. She died because of the colon cancer. Now, if you're going to trace what are the risk factor, because she is a president. Of course, if you are president, they will what? During the conference or during what? Every day, what will be your food? The king food. The steak, right? The king food, right? So more on the fatty food, right? Colon cancer, risk factor, diet. Number 5. Okay, let's go to the number 5. How to prevent UTI? Okay, anybody from the class?
Good
UTI prevention,
Hygiene.
hygiene. There you go, hygiene. And of course, we have to encourage what? Fluids intake.
Fluids.
Fluids. And also, I know that you know the cranberry, right? Cranberry, and we have to administer antibiotic. Okay, I know. Okay, so pretty much, you see the question, if you know the knowledge from the ebook, it's very easy to answer. Okay, still, you have to read the ebook, okay? Next, proceed. Next one. Okay, so I want you to go over first this one. Go over. I'll give you 2 minutes.
What's the question?
Where's the cup? What if you want? You don't have to. Put ourselves to ourselves.
Yeah.
That's fine. I don't mind doing that.
Just do it.
As long as the roof gets fixed.
Yeah, because that's like
That's the major. The side can wait.
Next topic. Next topic. Let's go to the next one. Number 6. Number 6 topic. Hold on. 6 items. Okay, reinforcing teaching regarding HPV. Okay, what is HPV? Human papilloma virus. Okay, so what is your health teaching? How to prevent this one? Anybody from you?
Multiple sex partner.
What's that? Yeah. So,
Safe
what is
sex.
okay? Safe, right? Safe sex, like a condom or the abstinence. Very good. So that will be the question. Next one, number 7, burn. Rule of 9. Do you know the rule of 9?
Yeah. Yes.
Okay. So let's do it together. Mr. Alex, can you show me the rule of 9?
Okay, so it's 9, 9, upper chest 9, lower chest 9, back same thing, upper back 9, lower back 9. I believe
The entire
whole
right leg is 18. 9, 9, right?
9, 9, and 1 is the private area.
Okay, and then this one.
Oh, and the face is it like, I don't remember, is it 9 or like
9, 4.5, 4.5.
Okay.
Rule of 9. Okay, so they will give you a calculation. Maybe they will give you, try to calculate this one. Entire right leg. Okay, so calculate plus anterior head. Can you calculate? They will give you a one question, how to calculate the rule of 9.
Entire race.
13.5.
Okay, 13.5. Did you agree?
Yep.
Everybody? Right? So are we good? What is your observation with the question right now? Knowledge, right? Knowledge. That's why if you have a good knowledge, still you will survive no matter what. Okay, next topic. Let's go to the next psychosocial integrity, 2 points. Okay, psychosocial integrity. Psychosocial integrity. 2 items.
+9.
Is that 13.5?
You said entire leg, so that's front and back.
18.
Oh.
I didn't get 13 points.
Oh yeah, you're right. I'm sorry. So entire right leg is 18.
Oh, okay.
Okay, and then plus what?
Plus 4.5.
22.5. Okay, thank you. Right?
Oh, okay.
So plus the
22.5.
anterior head is 9. So what is the answer?
22.5.
22.5.
22.5. Thank you, Mr. B. Okay, I need to drink some juice. Okay, hypoglycemia. Okay, next one. Orange juice is the best for hypoglycemia. Okay, next. Next one. Next topic. Psychosocial coping mechanism. Okay, they will ask you about the psychosocial. So usually for the psychosocial, so it seems, it sounds, tell me more. Okay, so this is the correct answer. For example, you are taking care of a patient, cancer patient. Okay, said, nurse, I want to die. What is your nurse best response? It seems, it sounds, tell me more. Okay, that's it. Then the next one, amputation. There's a question in amputation. Okay, so acknowledge it. So if they are complaining of nurse, I feel that I'm in pain. But of course, they don't have the lower extremities already. BKA or AKA, right? Below knee amputation or above knee amputation. So we call it phantom pain. Okay, so what will you do? Acknowledge it. Acknowledge, meaning to say, we can what? We can administer Tylenol. Okay, acknowledge. That's it. So 2 items. Next, this is the big deal. So listen carefully, 16 items. So the next topic that I will give it to you is 16 items. 16 items. Can I erase this one?
Yeah.
Okay, very good. 16 items. Overall is 90. 16 items. Okay, first topic, 16 items. We call it the basic comfort. Basic comfort, pretty much 16 items. Number 1 question, 3 items, 3 points. Okay, they break down. Okay, so the question is voiding disorder. Voiding disorder. Still, you study the topic. That is the thing. Voiding disorder regarding urge incontinence. What is urge incontinence? Tell me.
When you feel like you have to use the
When you have to go at the last minute.
Okay. So as long as you know how to deal with this one, that will be the topic. It can be all over the place. Okay? So the next topic for this one regarding elimination is bowel elimination. Bowel elimination. Okay? After surgery or post-op. Post-op. Usually, to prevent straining, right? Is
Yeah.
what? We have to give a colace. Colace. And of course, high fiber
Fiber.
diet. And of course, the best is ambulation. Ambulation. Okay? So they need to move. They need to move. Okay, next topic. Signs and symptoms for acute pyelonephritis. So they are asking about the signs and symptoms regarding acute pyelonephritis. Okay? So what are the signs and symptoms? Help me. Pyelonephritis.
Urine outputs.
What's that?
Low urine outputs.
Okay, yun. Okay, so you have to know what are the detailed signs and symptoms. Okay, so are we good?
Fever.
Fever. Fever. Okay, usually that is what? Pyelonephritis, what is that?
Inflammation of the nerve glow. I think the how do I call it? The tube of the nephrons.
Okay. So as long as you know this one, because again, the ATI is very detailed with the signs and symptoms. Okay, detailed signs and symptoms. Okay, next. Let's go to another 3 items. This is 16 items, remember? 3 items regarding fracture. Fracture. Cast care. Do you know the cast, right? The cast,
Yes.
how you will take care of that. So you have to make sure of itchiness, you do the pack. Okay? Don't insert something. Don't insert something. Oh, there's an echo. I don't know. Okay, next. Cast care, very important. What is that?
What is that?
Is that better?
Okay. I don't know what to do. Please, what's that? There's an echo.
I think just mute everybody.
Everybody mute.
All right, next topic. Next one, cast care and peripheral vascular disease. Another topic. How to promote circulation for peripheral vascular disease. How to promote circulation. Okay, what is the answer? How to promote circulation.
Application.
In PBD. Look up if you don't know the answer. PBD. How to promote circulation. Usually it's a lower extremities.
They could use a tettos. They could wear a tettos.
Warm compress.
Warm compress.
Warm compress.
Dead hose.
Yeah.
Warm compress. Very good. Okay, next. Knowledge is power. Next one. How to take care of a backstruction. Backstruction. Make sure that what? What is the concept in traction? Hanging free, right? Hanging free.
Hanging
right?
free, yeah.
And then make sure you don't need to what? Still, we have to reposition, but we have to take care of the traction. Hanging free. All right? So are we good? So that will be a 3 items. 3 items regarding what? Regarding for immobility. Another 1 item. Okay, next topic. This is 16 items. Remember, 16 items. 1 item. 1 item. The question is 1 item regarding the pain management. Pain management. Okay, but be careful. The question is all about the TENS. Okay, transcutaneous electrical nerve stimulation. TENS, if the pain, what? Medication. is not working anymore, right? We have to repair to who? Repair to the physical therapy. So the TENS is what? This is like a small machine, right? The small machine, they will apply to affected area like a pad. So, and then they will what? They will turn on the machine and you will feel like a electrical vibration. Okay, so are we good? Physical therapy. If the pain medication is not working anymore. Okay, next item. This is a big item. 9 items regarding nutrition. Diet and oral hydration. Okay, oral hydration. Okay, next topic. Let's do it. This is a 9 points. Okay, next, diabetes. Diabetes. Diabetes pretty much reinforce teaching. So usually the diet for the diabetes is no concentrated sweet, right? And at the same time, the best is diet and exercise. Okay? And make sure they are compliant with what? They are compliant with medication. Medication. Okay? So that is the question regarding diabetes. We have to do the health teaching. How you will reinforce the teaching. Diet and exercise. Okay, next. Next one. Heart failure. Heart failure diet. So, heart failure diet, CHF, is no added salt. Heart failure diet or CHF is no added salt. They are asking what is the diet. So, dietary teaching. What is the diet? No added salt. Maybe they will give you an example with this one. They will give you an example like patient said, I will eat what? I will eat salad for my dinner, which is good. So, patient said, I will eat my favorite canned broccoli soup. So this is what? Negative. Reinforce teaching.
Sodium.
Very good. Reinforce teaching. All right. So are we good?
Yes.
Heart failure. Next topic. Oh my God, there's a lot. Yes, ma'am. Okay, pressure ulcer. Pressure ulcer. Okay. So they are asking about the pressure ulcer. What are the dietary intervention for pressure ulcer?
High
Pretty
protein.
much
High protein.
high protein and diet. High protein and what? Vitamin C.
Protein, yeah.
Okay, so are we good? Okay, next. Next one. How to prevent aspiration. How to prevent aspiration. So Fowler's position.
Fowler position.
Okay, and then make sure you have to check the diet. Yeah, it should be what? It should be one at a time. Okay, and usually for aspiration precaution, we have to give a what? What type of diet? Puree.
Puree diet and chicken liquid.
Diet.
And
Okay,
chicken
very
liquid.
good. There you go. And with what? Thickener.
Chicken liquid.
Thickener. Thickens fluid. Okay, are we good? Next. Next one. What is calorie count? Okay, they are asking about the calorie count. What is calorie count? What is your idea about calorie count?
No.
Calorie count is what? Everything that you're
the amount
eating.
of carbohydrates.
Yeah, you just count it.
Everything you will calculate. That's it. That is a calorie count. Okay, next topic. Next. I think so. Okay, correct me if I'm wrong. I'm not really into calorie because I'm eating everything.
Yeah, like they said, adults should have like 45% carbohydrate, 10% protein, and all that.
Okay, so study that one just in
The
case.
amount of
Okay.
carbohydrates.
Yeah.
Okay, very good. Okay, next, because it's a lot of topic, I'll be a little bit fast. Next one, chest X-ray. Chest X-ray. Okay. So what will be the findings for the chest X-ray if they have a TB? Okay? If they have a COPD. So study that one. So pretty much in the chest X-ray, it's not clear. So there's something wrong, right? Okay, so that will be the question. Okay, next, dietary teaching for iron deficiency anemia. Iron deficiency anemia. Okay, so pretty much high in iron. High in iron. Okay, what are the example of iron-rich food? Select all that apply. Green
leaf, dark green leafy
vegetable.
vegetable. That's right.
And then what else? Organ meat, right? I'm anemic before. So I'm always eating chicken liver and you know but more on the chicken. Okay, so green leafy vegetable. Next, number 8, they are asking about if the patient is taking ferrous sulfate. Okay, what is your teaching? So take with vitamin C. Okay, why vitamin C? Why vitamin C? Because it can what? It can, why? It can what? Increase the absorption of iron. Vitamin C. Why not milk? Do not give milk. Because it will block the absorption of what?
Iron.
Of iron. Memorize that one. That is always a favorite. Okay, can you repeat again for me, Miss Lynn? What is your health teaching if I'm taking a ferrous sulfate?
Take vitamin C.
Okay, vitamin C. Why vitamin C, Miss Lynn?
Because it will help with absorption.
Help with the absorption of iron. Why not milk? Why not milk?
Because it blocks the flow of absorption.
Okay, very good. Okay, are we good? So I'll give you a 5 minutes break because it's too much information. Okay, 6:47. Can come back at around 6:55. Okay, I need to drink water. Okay.
Mushrooms. Yeah. That's for the portobello mushroom burger. Let's see. Yeah.
Hey B, I typed it. I couldn't write it. Yeah. I have 6 pages. Well, I just kind of abbreviated some of them like she did. Because the other thing that she said basic comfort was 16 items.
Yeah, I didn't see 16.
All I saw was all I got was three items for voiding disorder, bowel elimination, signs and symptoms of acute pyelonephritis. 3 items for immobility, and then 1 item for pain management.
There is 16. 9 for nutrition and all these. 3 for
okay. So we add in the
fractures.
8,
3
right?
for...
So the 8 is included in there. The nutrition and oral hydration.
Yeah, that's like 9 items.
Okay.
Wasabi. Dessert.
Doritos.
For the 16 items,
Yeah.
it was voiding, bowel elimination, signs and symptoms, fracture, cast, how to prevent circulation, pain management.
And then there's a lot in nutrition.
Yeah.
Hydration.
It's a lot. Thank you very much.
Sorry. I was saying that let me know if you're getting anaphylaxis. I'll give you Benadryl. Just knock them out, right, Rahel? Just knock them out right away.
Tells you.
KO. What are you eating?
Oh.
Oh, it's good, James. Oh.
Doritos. Pehingi
There are
kuya.
Doritos, guys, even in the
I have to
classroom.
go to kainan after our class.
What?
Party
Where?
ba? Party ba sa ano?
Oh, it's Dr. B's birthday coming up.
Oh man.
Lot of
Yeah.
a lot of lipstick.
Lipstick.
Yeah, they're celebrating it at their house.
Wow,
So are we all
you're
going?
It's
updated.
close.
Are we gonna
It's close.
crash?
B, it's close to your house. It's in Skokie.
Share your location.
Did he order shomai?
No.
No?
Nope. The price increased though.
Oh,
It was
35,
used
right?
to be, yeah, it's 35 now.
I think because
As
of
they said
the
that the
COVID.
meat got expensive. I don't know.
How much is it now, Rohel?
35
How
for
much was it
50
before?
pieces. 25.
Oh, that's not bad. Probably from
Identification.
the airport. Is somebody checking in the airport?
Checkpoint.
Oh, that's a good question.
They have a checkpoint.
Checkpoint.
I'm
Border.
not sure. Maybe. They
But
should be.
even in the Philippines, if we go home, we're gonna be quarantined like 3 weeks.
Really?
So almost
But yeah,
1
and
month.
and then if you're like you go there for vacations, you have to pay for your own hotels and everything.
Yep.
Yeah, same
Yeah,
same thing,
same
same
thing with
thing
the
over in the Philippines.
Philippines.
Ooh, yep.
That sucks. So mainly, like your 1 month is in doing quarantine. It's
And that would
supposed to be your
suck.
vacation.
And you're only gonna be there for 3 weeks? Ooh, nope.
Never mind.
Shit, I go to a motel. Fuck that.
But then you get corona instead.
Yeah.
I'll bring lots of sanitizer.
Instead of
I'll bring lots of disinfectant.
That's true.
I'll
Yeah,
shower
a lot
with
of those
sanitizer.
hotels have hand sanitizer. And massage.
Which hotel is that?
Rahal will go.
The one with the card. You
The
get
one
the
with the
card.
happy hour.
Frequent.
Is there a happy ending?
Happy ending.
It's a flower card.
With happy ending included.
What are you guys doing today for lab? It's 3 of you, right?
No, it's just me and Kuya
Just
James.
me and
Oh,
Roel.
you guys are doing catheter?
No,
No.
we're doing medication. GI.
Through
I thought
G-Tube.
Rahal is gonna be the model.
Oh, Hannah.
Yeah.
Oh,
Yep.
Oh.
Okay.
Jay, are you ready, Jay? I'm excited.
Is his hair still
I
long?
can't wait, Jay.
His hair still is
pretend
probably
that he
extra
doesn't.
long now with no haircut, right?
No, you can, if you have like you can like set an appointment if you want to get a haircut. Well, lucky you.
I just got a haircut.
Isn't that just a buzz cut? Oh, she did? Oh yeah.
That's a big trust then.
Yeah, Melissa, you should learn how to cut hair.
I know I don't cut a hair, but Louis doesn't want me
Cut
to.
Boo Boo's hair.
He was like, no, never
Cut
mind.
Boo Boo's hair.
Ooh, are you using the book?
Well, I'm gonna use it now.
Oh, because the ebook seems like they're just short, but in
Yeah.
the book, was it
They're
like a
the
difference or
same.
anything?
They're the same.
They're the same.
Basically the
They're the
same.
same.
Yeah.
Okay.
In the ebook, so you don't really need the book unless if you want to, highlight and stuff.
Yeah.
Yo, you can highlight
But you
on the
can
ebook,
always
yo.
you can always print.
You know what I don't like is you gotta scroll. You gotta scroll down,
Yeah, that too.
and if you click the arrow to the right, it kicks you to the next chapter.
Yeah, do you still work at the FedEx? Is that FedEx?
Yeah.
Oh, you can print out all the ebook pages.
It was only $25 on eBay, the whole stash.
Oh, really?
Yeah, I bought it for 25.
Man, I got scammed. I
Then
got
naman.
both book for.
Melissa, you had the other one, right? 26.
No, I didn't buy it. I just used the ebook.
I got mine for $20 each book, and I only got Pharma, and MedSurge.
$25.
What? I got scammed.
Yeah, for the whole thing.
No.
Yeah.
James, which website you buy that book on?
What? eBay.
Really?
You gotta, I just saw it on eBay.
Is it new, Kuya, or is used?
It's used.
Oh, okay. But still don't really matter. If it's...
See, right there. See?
Man, I got scammed.
It's pretty new. $25.
I'm gonna get a refund.
For all of those books?
Yeah.
Wow.
I got my 2 books for $40. What the heck?
Oh my god.
Yeah, you're gonna. I'm gonna send the money and you order it for me.
Send
Let's
it to
see.
me.
I don't know if they're same items.
I think they're the
You
same.
sure you have the right book?
Yeah.
Send me a
Here,
send me a picture of those books. Let me order it.
Here, I'll do a screenshot.
Yes, sir. No,
Yeah.
don't worry. We can still use it. You never know.
Terry, did you ask Miss Mary Jane about the lab, about the clinical?
I'm waiting for her after this, and I wrote something on UTI for mine. I hope I'm doing the right thing.
Yeah. Yeah, but I thought it was today.
I think maybe after this class, and she probably do it. I don't know.
And there, I put it on.
Let's do it again.
Yeah. All right. We're
Yeah.
back.
Anybody remember that book that Miss Evelyn told us we could read? That LPN book that she said she got from the library. Do you think that's good? Anybody have it?
Yeah. The NCLEX book.
That's an NCLEX book?
Yeah.
But right now, ATI book.
Yeah, ATI first. Don't worry about that one.
Don't worry about that one. Because in ATI, you have to read the ATI. It's a business. Okay? They want you to read the ATI book. Okay, let's do it. So the next topic, okay? Next topic is 14 items. This one is 14 items. Okay? So the first topic regarding, they are asking about the adverse effects, side effects, and medication interaction. Interactions. Okay? So, number 1 question is congentin. What is the side effects of congentin?
We can't see your board, Miss Mary.
Okay.
Thank you.
I can
You
see. Yeah.
Yeah.
Oh, you can?
I
Hold on.
can see it clearly.
Oh, okay, I see it. Sorry, I have it.
You will be
My
in
bad.
trouble, Mr. James. Okay, just
Sorry,
kidding.
my bad.
All right.
My bad.
All right. Now, congentin. So you have to study what is congentin to prevent EPS. You have to study everything about congentin or benzotropin or congentin. Okay. You have to
To
study
prevent what, Miss Evelyn? To prevent what? EPS?
EPS, extrapyramidal signs and symptoms. If they are taking Haldol, so you have to give a congentin. Okay? Okay, next one. They are asking about antibiotic. Antibiotics, silin, mycin, right? So what are the side effects? You know the side effects. More on GI first. GI. Side effects, GI. And then adverse effect, you know that all the toxicity in the whole
world.
Okay, that's it. Adverse effects. Okay, so the next one, aside from that, is non-opioid analgesic. Non-opioid analgesic. Okay, such as Tylenol, right? So the Tylenol do not give to who? To the liver patients. Hepatotoxicity. Okay? And also the non-opioid analgesic is cross sensitivity of sulfa. Sulfa. Okay? Cross sensitivity of sulfa. Okay, so again, aspirin is to not give to who? To the children. Because it can lead to Ray's syndrome. Okay, next. Next one, contraindication or who is nitroglycerin. Nitroglycerin, we have to what? This is a treatment for angina. We have to administer 3 times with a 5 minutes interval. 5 minutes interval. Okay? 5 minutes interval. Hold on. 3 times.
Otherwise, call 911.
Very good. 911. Okay, 5 minutes, 3 times. And then under the tongue. Under the tongue. Okay, we have to give a sip of water. Okay? Sip of water. Because dry mucosa can inhibit the action of nitroglycerin. Dry mucosa can inhibit the action of nitroglycerin. Okay? Next one. Reinforce teaching about iron. Iron, again, as I told you, you have to take with vitamin C to increase absorption. Okay? Not milk, because it will decrease the absorption. Okay, next question about medication. They are asking about metoprolol. Okay, olol, metoprolol.
Beta
Okay?
blockers.
So actually, the beta blockers, the metoprolol is one of the safest. Olol. Okay, the carbidolol, and propanolol, we have to be careful because do not give to the MI patient. Okay, MI or what? Respiratory patient. Okay, MI or more on the respiratory patient because it can lead to what? Something, shortness of breath. Okay, and then aside from that, you have to check the blood sugar. Check blood sugar for what? For a diabetic patient because it will mask the signs and symptoms of hypoglycemia. So pretty much before giving the olol, aside from checking the BP and the heart rate, you have to check the blood sugar. Okay, are we good? Yes or no?
Yes.
Okay, next, proceed. Oh, this is a lot. You have to be careful with this question. This is 14 items. This is a little bit complicated because this is a medication. Next. Next one is the patch. The patch, any patch in the whole world, we have to place on the non-hairy area. Place on the non-hairy area. Okay? Non-hairy area. Okay, next one. Aside from non-hairy area, the best example of the patch is nitroglycerin patch. Where to place, Mishri?
A non-airy area.
Non-hairy area. There you go. Okay, next, insulin. For the insulin is you have to rotate the site. You have to rotate the site. And also study the combination of insulin. Combination of insulin, Niña-Ricci RN. Or if you don't like the Niña-Ricci RN, cloudy clear, clear cloudy. Okay, next one. So I'm done with this one. Let's go to another 3 items. 3 items, another topic. 3 items, there is a calculation. So you have to know the dosage calculation. How to calculate what? How to calculate the heparin study. We cannot go over right now because there's a lot of topic. Heparin injection, how to calculate heparin, IV, okay? And of course, capsule. So it's easy. All you have to do for the what? For the capsule of tablet is D over S. Hold on. Divided by S. Or I want divided by I have. Okay, what do you mean? I need 500 milligram of what? Of Tylenol. But I have 250 milligram in my hand. So what will be I want? 500. What is I have? 250. How many tablets I need to take? 2. That's it. Very easy. Okay, next. Next one, IV. Again, if you know the IV, this is my method. IV, you need to know the total volume. Multiply the total volume with the given of drop factor. It's given. So they will give you sometimes 100 ml of total volume. You multiply by drop factor. Drop factor. It's given. And then you divide it by what? Minutes. Okay? So, how many hours to run the IV? It can be what? It can be 5 hours. And you multiply by what? By 60 minutes.
60 minutes.
Okay, that's it. Okay, again, you have to practice. Okay, because there's a lot of topics, I want to go over everything today. Okay, next one. Actually, if Mrs. Stephanie will give us one more day next week to meet, if you are available, I want to go over with the ebook as in discussion.
I thought we had Monday.
Oh, we have Monday, right?
Yeah.
Yes.
Yeah, we have.
Okay, we have Monday. Okay, I'm sorry. We have Monday afternoon. So, I will use that one for ebook. Okay? I don't mind to go over with medical surgical. Okay? So, we need to go over with the topic in medical surgical. Because I'm not your teacher in med surg. Okay, next. Next one. Next topic. 2 items. 2 items. Under 14 items again of pharmacology. 2 items under pharmacology. Okay, so what is the question? Oh, by the way, don't forget the heparin injection. Heparin injection is a very popular. Do not massage the site, right? Do not massage the site.
And rotate the injection site.
Oh yeah, aside from rotated, very popular, that answer is for insulin.
Okay.
Usually for the heparin, the
It's
popular
not
question for
massage.
ATI is do
Okay.
not massage. Very good. Okay. And then of course, sub-Q with a 90-degree angle. Okay, next topic. 2 items regarding what is spironolactone. What is spironolactone?
Potassium sparing diuretics.
Okay, potassium sparing. Okay, and then what is LASIK? Potassium wasting.
Okay, hold on.
Okay, potassium wasting. Spironolactone, the side effects is hyperkalemia, and LASIK is hypokalemia. Okay, are we good? Yes or no? Okay, next. What is oxybutynin? This is for GI. Study this one, ditropan. Okay, they are just asking, what is your health teaching if the patient is taking oxybutynin? Can you take a look? Take a look with that. What is that? Without food. Okay, so they're just asking what is the health teaching. That's it. Okay, are we good? Okay, next item. Next one, 3 item regarding insulin. So again, the Niña-Ricci RN. Niña-Ricci RN. Right? And then you have to rotate the site. Rotate the site. All right? Next topic. Next topic is blood glucose evaluation. Okay, so blood glucose evaluation. So pretty much, what is the normal value? 70 to 110 milligram per DL. Maybe they will give you like 150. What will you do? They will give you 50 milligram per DL. What will you do? Give orange juice. Give orange juice. If they are giving you what? 180 milligram per DL, meaning to say, what will you do? You administer what? Administer insulin. Right? So that's the one. Okay, next. Next one. You see, even this is a med search. There is a palm. Right? Okay, next. Next one. Next topic. How to administer Lobinox. Same with what? Same with heparin. Given sub-Q. This is a commercially prepared what? Commercially prepared medication. You see, even this is what? This is MedSearch. There's a lot of what? 14 items of pharmacology. Okay, are we good?
Yes.
Okay, next topic. Can I clear this table?
Yes.
Okay?
Yes.
At least we are done with this one. On Monday, I'll go over with the discussion. Okay? Still, knowledge is power. Knowledge is power. Okay, next. Let's do the next one. Next one, another 14 items. Oh my God. Yes, ma'am. 14 items. The question for the 14 items is number 1, diagnostic test. No. The title actually for the 14 items, sorry, I'll put a title, reduction of risk. It's a category in NCLEX. Usually how to prevent, how to prevent any risk for the, for the diet, for everything, laboratory values, but here more on the laboratory. Okay, so this topic number 1 item, they are asking about diagnostic tests regarding colonoscopy. Again, take note. The colonoscopy is visualization of the colon. Usually, any GI procedure, write it down. The patient needs to undergo enema. Okay? And the patient needs to take some laxative before the procedure, and they need to undergo a fluid what? Fluid or liquid diet for about 3 days. Okay? Before the procedure. Okay? Are you following me? Yes or no? Everybody?
Yes.
Okay, very good.
Yes.
Next, it's a lot. I'm sorry, but you told me a review. Okay, next, liquid diet, right? Liquid diet. And then the next one, for the colonoscopy, visualization of colon. Okay, make sure that it's clear. Because if they are giving you a data that the stool is still there's a it's not clear, meaning to say you did not follow the enema, the laxative, the go lightly, so on and so forth. Okay, so meaning to say we need to intervene. Okay, next, proceed. Another question about the GI laboratory values. Okay, you memorize laboratory values. So pretty much they will give you a different values to report. For example, as I told you, what are 3.4? Are you going to report the potassium 3.4?
Yes.
Yes, still yes. Okay, so the question here is the laboratory values to report. So, and then the question here, 1, 2, 3, 4, more on the acid-base balance. Memorize the ABG. Okay, let me know. Let me see your power, Yadira. Tell me the laboratory values of ABG.
ABG.
pH.
Oh, the pH is 7.35 to 7.45.
Very good. How about the
PCO2 is 35 to 45.
There you go. And then what else?
PHO3 is 22 to 26.
Okay, there you go. So you memorize that one. Maybe they will give you this topic. Write it down. Maybe they will ask you about what is respiratory acidosis. What is respiratory alkalosis? Okay. And what is metabolic acidosis? And what is metabolic alkalosis? You know, I have a very, very simple explanation for this one. You know what is my explanation? What is the pH? 7.35 to 7.45. I will take a look for the pH. If the pH is less than 7.35, I will put acidosis.
Acidosis.
Yeah, if it is up 7.45, I will what?
Alkalosis.
Yeah, that's an easy. Next, I will take a look the PCO2. If the PCO2 is abnormal, okay, this is my own, this is my own style. If the PCO2 is abnormal, up or down, significantly, you know, I will put respiratory. If the bicarbonate is up and down, significantly, up and down, I will put metabolic. How about they are the same? Okay, I will just, you know, I will just get the what? The significantly high or low. If they are both abnormal, I will pick. If the what? If the PCO2 is more abnormal than the what? Bicarbonate, that is my answer.
Okay.
That is my own style. Okay? I will not make it hard for you. That's it. Because there's a lot of information in the what? In the internet that they making it hard. Period. Okay? Did you follow?
Yes.
Have any problem? Yes. Now, next topic. They will not give you the numbers. They will give you the disorder. Okay, just in case they will give you a diarrhea, the answer is as. Metabolic acidosis. Okay, that's the answer. If they are giving you like what? Like a vomiting, so the answer is metabolic alkalosis. Okay, if they are giving you asthma, acidosis. If they are giving you asthma, do you know the asthma, right?
Yes.
Asthma, so the answer will be respiratory acidosis. This is the answer, okay? Respiratory acidosis. So are we good? Yes or no?
Yes.
Okay, there you go. Asthma. They are giving you DKA, metabolic acidosis. Okay. So now, where to get this question? The question in ABG, you can open your book or you can open the Saunders book. Okay, there's a table, very detailed. All the what? All the, if I have an opportunity, I will just take a picture and send it to you to the WhatsApp. Okay? So metabolic. But remind me. Okay, remind me maybe tomorrow. Take opportunity. I will just, you know, pack and then send it to you to your WhatsApp. Okay, next, proceed. Next one that we go over, that's 4 items. Okay, really? Yes, ma'am. And then the next topic is alteration in the body system. Okay, osteoporosis. Osteoporosis and osteoarthritis. Okay, what is the question behind that? Reinforce. Okay, let me know. Reinforce teaching. So how to take care of a patient undergoing osteoporosis and osteoarthritis. So you have to teach about what? About the importance of what? Calcium and vitamin D. And also diet and also exercise. They will ask you what is the best exercise. The answer is swimming. Okay? Swimming. Okay, next. Next topic. Next topic is data collection, cardiac catheterization. Cardiac catheterization after the procedure. you have to inform the patient to place their legs in a straight line. Straight, right? So place the leg in a straight position because the cardiac catheterization is in the femoral. Okay, we have to what? It should be a straight. Okay, after liver biopsy, okay, biopsy, what will be the position? To the right. Okay, why? Where is the liver? To your right, right? So after that one, we have to apply direct pressure. Again, biopsy, you are trying to what? What is biopsy? To rule out if it is a malignant or cancer, right? You are trying to what? To, Mr. B, what is your answer? What is biopsy? You are trying to what? But you are trying to get a small
sample.
Sample. Okay, so pretty much the complication or the what? We have to check for bleeding. Okay, after the biopsy. So apply direct pressure. If they will ask you liver biopsy, during the liver biopsy, you have to place the patient to the what? To the left, to expose the right. After apply direct pressure, you have to place to the right. Are you following me? Yes or no? Okay, now, next one, kidney biopsy. After the kidney biopsy, what will be the answer? Kidney biopsy. Kidney is what? So it should be supine position. Okay, next topic. They are asking about the lumbar puncture. Lumbar puncture during the test or intra-test, fetal position. Fetal position. So after the test, what is the position? Supine position. Apply direct pressure. Okay, that is a favorite, my dear. Apply direct pressure and also supine position to prevent spinal headache. Okay, are we good?
Yes.
Yeah, next topic. Then if they want to what? If they want to drink something, that's fine. But do not place in a Fowler's position. It's still supine. And then you have to give a straw. Okay, and then a little. Okay, so the next one that we have to go over is, hold on for a second. Okay, another 4 items. This is all about 14 items, okay? Another 4 here is paracentesis. Tell me what is the paracentesis? Removal of what?
The fluid, excess fluid from the abdomen.
Where? From the abdomen. And what is the position? Supine position. Okay, they are asking about paracentesis. Study the paracentesis, not only on the particular topic. Okay, next one. Okay, discharge teaching regarding biopsy. So we're done with that one. Okay, any biopsy, what is your health teaching? Apply direct pressure.
Direct pressure.
Okay, direct pressure. Anything. Okay, so I think there's a one question here regarding breast biopsy. Still the same. Apply direct
pressure.
Okay, aside from liver. Next topic. How to check the placement of G-tube. Okay, how to check? How to check the placement of G-tube? Anybody from the class?
I think you get the residual one. Check for the residual.
Which should be
you check for the residual.
Okay, what else?
For the pH gastric. So it should be
okay.
for
X-ray, of course.
For the placement.
Okay. For the placement. That is the confirmation. Okay. So first you have to what? You have to check, right? You have to aspirate and check if it is acid
Gastric content,
yeah, the gastric content.
Yeah,
Second, you have to auscultate. There are gurgling sound, and then the third one is what? If you to confirm X-ray. Very good. Next one, next topic. Eye teaching following cataract. So pretty much anything post-op regarding eye surgery. We have to treat a patient like a blind patient. They cannot say, I will what? Watch my favorite telenovela all day long. Okay?
No.
Cataract is opacity of the lens. Cataract is opacity of the lens. So what will be your health teaching? The health teaching is do not bend, right? Do not what? Make sure we have to give
James,
what? Always. Okay?
Excuse me, Miss Mary
Yeah.
Jane.
Yes.
James said he got kicked off of Zoom. If you could put him
Okay,
back
he
in.
needs to go out. He needs to come back.
Okay.
Come back, and I will admit him. Okay. How are you, Miss Joyce? Open your cam. Open your unmute. How are you? Are you learning?
Yeah.
Okay. How about you, Miss Patel? Miss Patel? Miss Patel?
Yes.
Okay. Are you learning?
Yes.
Okay. Just follow the instruction that I gave you. You can join on Monday. No problem with us. Okay? All right. If you're still interested. Okay. Next one. So next topic. I'm waiting for Mr. James. Yeah, 14 topics. So there's a discharge teaching following cataract surgery. I will give you something more on Monday again. Okay? But process. I cannot do, like, choo. You will be confused one by one. All right, are we good?
Yes.
Waiting. There's more two items in 14 items. There's another 2. Okay, James. Okay, we're good, Mr. James. Mr. James? Mr. James?
Yes.
Okay,
I
so
got
we're
in.
good.
Sorry, I don't know. I lost my connection.
It's okay, it's okay. Okay? So it's okay. So, okay, let's move on. Another 2 points. Okay, another 2 points here is regarding bronchoscopy. Okay, study what is bronchoscopy. Visualization of the bronchi. What is your reinforcing teaching regarding bronchoscopy? Okay, so pretty much from bronchoscopy is still the magic number 5. Before the procedure is NPO, consent, allergy, health teaching, and laboratory. Visualization of the bronchi. Okay, what is the position of the lumbar puncture again? Fetal position. Fetal position. Why we need to perform a lumbar puncture? To rule out meningitis. Okay? So there's another question about the signs of meningitis. What is Koenig sign? Koenig sign, you what? Unable to what? This one. The lower extremity, unable to what? Unable to extend to a 90-degree angle. Koenig sign. Okay, and then how about the Brudzinski sign? Brudzinski sign. Right, correct me if I'm wrong. So flexion of what, Mr. B? Your knee and the neck. So meaning to say, meningitis. So pretty much this is the 14 items. Okay, next one. The next one is the 25 items. This is the last topic. Okay, at least we survived today. Okay, but again, do not limit yourself with this one. I'm just helping my dear. And then I send you the what? The question that I have, right? But not what? Limited on that. That is the question before that I have in my hand, that I print before because I'm doing, like an evaluation. So I need to print the question. It came out before. but it's not a guarantee that it will came out again. But at least you have like a visualization, you have an idea that how they ask question. Okay? So are we good?
Yes.
Okay, next topic. Okay, next topic. Hello. Okay. Next one. Next one is 25 items. Okay, so can I clear?
Yeah.
Okay, the last topic, 25. Oh my God. 90. 90 is the total. 25 items. This is a little bit in-depth for the med search. We call it physiological adaptation. It's more on the signs and symptoms now. Okay? Number one topic, 12 items. 12 items, they are asking regarding suctioning. Maybe this is a drag and drop. How you perform the suctioning. Okay, I will just give you right now the topic because next week I will go in depth. Okay? Okay, the suctioning. Suctioning and then hematology. They will ask about the bone marrow aspiration. Okay? So for what? For hematology. Okay, next topic they are asking, what is EKG monitoring? So we have to deal with the EKG monitoring, my dear. Did you go over this one?
Yeah.
Yes.
Okay, the 8 strip, how to do the interpretation?
Yes.
Okay, but I'll give you something on the, on Monday. EKG, I have a 8 strip, okay? EKG monitoring. Next one, appendicitis. Okay? So if it's pain, very painful. Meaning to say, it's not really what? It's not really ruptured. If it is painless, meaning to say, that is what? That is a ruptured already. Okay, are we good? So this is emergency. Okay. So the next one. So what will be the position? Position of comfort. Okay, we have to place the patient where? Position of comfort. Okay, I need to go in depth with this one, 25 items. Okay, I'll do it on Monday. Next one, COPD. COPD airway management. Okay? So maybe they will ask you about what to do if the COPD is having a shortness of breath. Okay, tell me, Miss Erica, if you are the nurse and the COPD patient is having a shortness of breath, what will you do?
You raise the head of the bed.
Okay, and then what else?
You give oxygen.
But only 2 liters. Only 2 liters per nasal cannula. Okay, only 2 liters. Because COPD, the problem is what? The problem is not the oxygen, carbon dioxide. Okay, are we good?
Yeah, they're allowed to cough. They're allowed to cough too, right? To clear airway.
So we need to say, what will you do, Miss Shadira?
No, just basically instruct the patient to cough just to clear all airway, just in case if they are congested.
Or we can do the suctioning too, right?
What about abdomen breathing? Abdomen breathing.
Yeah.
Yeah, we can do that too.
Yeah, to
We can do
eliminate
that too.
CO2. Yeah.
Okay, very good. All right, next. So only 1 point. Next one, colostomy care. Okay, anybody from you, how to change a colostomy or how to do the colostomy? Miss Melissa. Miss Melissa? That's fine, just try.
You have to check the ostomy for any signs of infection.
Mm-hmm. Then also you have to what? The stoma, right?
Yeah, the stomach.
Every time you have to check the stoma, it should be pink.
Pink.
not the dark pink.
Blue, purple.
Okay? Because if it is a dark pink, there's something wrong with the circulation. And then make sure every day they improve. You have to measure the stomach. Don't tell me 10 centimeter first day. And then the next day, don't tell me 15 centimeter.
Oh no.
It should be what? Every day or every week, it should be what? Less, not more. Okay? Are we good? Okay, next. Next topic. Okay? Next topic is how to take care of a patient with peritoneal dialysis. So this is a big topic that you have to read. But we will go over it on Monday. Peritoneal dialysis. Peritoneal dialysis, you have to perform where? At home, right? You can perform at home. But the hemodialysis is exclusively where? In the hemodialysis, what? Center. Like the Beta or what? The Beta, what else? Fresenius, so on and so forth. Hemodialysis. Okay, next. Next one. Trach. Oh, so you have to study the trach for now. Tracheostomy care. I don't know what is the question. Maybe how to perform a trach care. Maybe a drag and drop. Okay, maybe a drag and drop. Okay, next. Next one. They are asking about the heart failure. How to intervene a heart failure. Okay, let's do the CHF.
We'll call you later.
CHF. Signs and symptoms of right CHF is edema. You remember the dance step? Ascites. Memorize this one. Ascites. Hepatomegaly. Splenomegaly. And jugular JBD. Okay, distension. So that is for the right. Left CHF, of course, anything about lung or pulmonary. So, coughing, right? Okay, what else? Crackles. Okay, pink proti is sputum. Okay, dyspnea. Okay, and then orthopnea. Anything about lungs. Okay, next topic. They are asking the 4 stages of pressure ulcer. Okay, write it down. What are the 4 stages of pressure ulcer? Stage 1. Stage 1 is only what?
Non-blanchable
Stage 1.
Non-blanchable.
Non-blanchable or redness.
Mm.
Stage 2 is blister. Meaning to say, the what? Epi and the dermis are partially torn. I call it blister. Okay, stage 3. Stage 3, muscle is involved or the fascia is involved. In the other book, muscle is stage 4. Okay? So I call it stage 3, fascia or the muscle is involved. Stage 4, bone is involved. Bone is involved. Okay? So how to take care of the stages? Okay, pressure ulcer, stage 1, reposition. Reposition and apply Basa cream. But in general, how to take care of the pressure ulcer? SATA. So we have to make sure, number 1 is reposition. Okay? How to take care for what? For the pressure ulcer. Okay, number 2, make sure we what? We administer what? What type of diet? High in protein
diet
and vitamin C. For what? For healing. Vitamin C. All right. Number 3. Number 3, protein, vitamin C. Aside from that is the mattress. What type of mattress?
Air mattress.
Low air
Air
loss.
mattress.
Or
Very
air
good.
mattress.
Okay, we need a doctor's order for this one. Okay, next, aside from that, of course, reposition. Oh yeah, I told you reposition. All right, so are we good? Yes or no?
Yes.
So, this is a 25 items. So, you have to study on this scenario. Okay, next. What is pulmonary edema? And what are the signs and symptoms of pulmonary edema? And what will be the intervention? Okay? Interventions. Okay, pulmonary edema. Okay, next topic. ICP. This is a big deal also. ICP. Intracranial pressure. Okay. So the question here is preventative measure. So ICP, pretty much, we have to place on a semi-Fowler's position. The degree is 20 to 30 degree. If you cannot find 30, okay, at least 20 to 30. 20 to 30. But again, the best answer is 30. Not the 90, not the 45. 30 is the best for ICP. Okay, and then you have to what? We can suction, but PRN only. Do not ambulate, right? Do not ambulate. Okay? And then, if the cause of the ICP is hypertension, of course, we have to give what? We have to administer medication. For what? For whatever the cause is. Okay? Oh my goodness, it's a lot, right? But it's okay. Okay, next. Next question. They are asking the signs and symptoms of Addison disease. I will go on depth on that on Monday. Addison disease. Everything is down. What is the hallmark sign of Addison disease? Dark pigmentation.
Dark pigmentation.
Dark pigmentation. Okay? Very good. Dark pigmentation. Okay, next, everything is down. And then Cushing disease, everything is up except potassium. Addison disease, D down, everything is down except potassium. The star of the show for Addison and Cushing is the potassium. Okay, Cushing, moon phase, right? So what, Bapaluham, right? You have to know this one. Bapaluham, they will ask you what are the signs and symptoms. Okay? So next topic. It's a combination of 25, There's another 4 items here. 4 items. Can I erase this one? Take a picture.
Yes.
Okay, another 4 items. So the question they are asking about the signs and symptoms of hyperthyroidism. Hyperthyroidism, everything is up except there is no menstruation, right? So what will be the medication of hyperthyroidism? Lugol solution. Okay, SSKI. Okay, so on and so forth about the iodine. So hyperthyroidism. Okay, next, they are asking also hypothyroidism. What is the drug of choice? We call it levothyroxine. Very good. Levothyroxine or, of course, Synthroid. So we have to what? We have to give early in the morning with the before breakfast, right? And check the pulse rate. So that will be the question. Signs and symptoms of hypothyroidism. Okay, Parkinson disease. Parkinson disease, signs and symptoms and priority. Priority for the Parkinson disease, obviously.
Safety.
Oh my God. Safety. Okay? Next one. Next, aside from that, another 4 more items. 4 more items. There's a lot. Fluid volume deficit and fluid volume excess. Select all that apply signs and symptoms. Okay, study that one. Okay, signs and symptoms. At least we are almost done. Okay, next topic. Next topic, LASIK. If the patient is taking LASIK, this is potassium what? Potassium wasting. So we have to give a potassium-rich food. Can I give banana? Yes, ma'am. Can I give avocado? Yes, ma'am. Can I give oranges? Potato? Yes, ma'am. Okay? So next, dehydration. What are the signs and symptoms of dehydration? Dry oral mucosa. Okay? And of course, we have to encourage fluid intake. Okay, another 4 more items here. Oh, there's a lot, huh? 4 more items. Incentive spirometer. How to administer incentive spirometer? Anybody from the class? Let me see your power, Ruhel. Mr. Ruhel? Ruhel? Ruhel?
Royal.
Ruhel, make sure, Yadira.
Yeah.
It's not what? Washing the what?
Washing the dishes.
Okay, where is Ruhel?
He's doing laundry.
Doing laundry.
He went really far.
Okay. Next, let me see. Charmaine. Miss Charmaine. Incentive spirometer. Show me your power. You can do it.
I'm washing dishes.
Oh, no. You're not washing the dishes. Okay, go ahead.
You're in class.
You're in class. Go ahead, my dear.
I know. You have to breathe into it.
Yes.
Yeah.
And then it evaluates the pressure of your air that's coming out of your lungs.
Mm-hmm.
Okay, well, Yadira, give me a second. Let me talk.
I was just trying to help you. I thought you were drying the dishes. Sorry.
No, I'm here. It's just I know
the floor is yours, Miss Charmaine.
Okay,
do not talk. Okay, the floor is yours. Okay, go ahead.
I know. Okay, I'm copying Yadira. Okay, so you breathe into it, and that's how you measure the pressure. Yes.
What happened?
You hear me?
You cut off.
Yeah.
Hello?
Okay.
We can hear you now.
Oh. I said like you blow air into it and then it'll measure the pressure of your lungs or like how well you could breathe out. I don't know. Is that right? Am I sort of right?
Yeah.
Yeah.
Okay.
More on the inhale than the exhale.
Yeah.
Oh.
It's actually to prevent your lungs from getting pneumonia too.
Yeah.
So
you have to place the patient in a Fowler's position.
Fowler's position.
Right? Yeah. And then you have to what? The incentive spirometer. You have to seal with his or her lips. And then instruct the patient to inhale. And then hold your breath for 5 to 6 seconds. And then exhale. That's it. And then repeat 1 to 2 hours. Okay, next.
Thank you.
Next one. Yeah, thank you.
Miss Mary
Okay.
Jane.
Yes.
Can you go over a little more FVD and /FVD sign and symptom? What is that? FVD.
Fluid volume deficit.
Okay.
So the fluid volume deficit, I'll go over you on Monday because I need to go over with the ebook. Okay. Fluid volume deficit pretty much is just like a dehydration.
Okay.
Dehydrated. Like dry oral mucosa, everything is down. Okay. And then fluid volume excess is edema. But I'll go over with you on Monday. It's because it's in depth. Okay. So the next one that I need to go over with you is regarding, fluid volume, excess fluid volume. The client is taking LASIK, monitoring for dehydration. They are asking what is Guillain-Barré syndrome. Guillain-Barré syndrome is ascending paralysis. And the priority for Guillain-Barré syndrome is respiratory. So anything leading for respiratory, like auscultate the lung sound or check for aspiration. Okay? So the next one, seizure. What is our priority for seizure?
Safety.
Safety is our priority. Okay? Next, they are asking about what will you do for MI. MI, myocardial infarction, what to do? MONA. O, morphine sulfate.
Morphine. Okay, I didn't know that one.
Yeah. Okay, O, oxygen. And then N, nitroglycerin. And then, of course, N is nitroglycerin. And then A, aspirin. Okay, so that will be another question. Okay, next one. They are asking about iron deficiency anemia. What are the signs and symptoms? Again, obviously, pale, pallor, fatigue, right? Dizziness. And what will be the laboratory result? In laboratory result, of course, hemoglobin, hematocrit. Okay, hemoglobin, hematocrit, and hemoglobin, hematocrit. Hold on for a second. Hemoglobin, hematocrit are down. Okay, and then of course, RBC are down. Okay, laboratory result for iron deficiency anemia. Okay, next, pernicious anemia. What is the hallmark sign of pernicious anemia? Again, vitamin B12 deficiency. The hallmark sign of the pernicious anemia is BP, red tongue. Okay, they are asking about what is the laboratory or diagnostic test. We call it Schilling test. What is Schilling test?
I don't know.
See your power, Miss Mika. Miss Mika, what is Schilling test, my dear?
A Schilling's test.
Yeah.
I don't know.
Okay, Schilling test is a 24-hour urine collection. Okay? To what? To determine the presence of what? Vitamin B12. Okay, very good. Vitamin B12. So, in the morning, we have to collect at 8 a.m. and we have to discard the first void. And then, we have to place everything that we collected, the urine sample, in the refrigerator and then stop the next day. Okay? So
Miss
that,
Bridget,
yeah.
I think the same method is used for, I think, for kidney problem also.
No, the Schilling test is for pernicious anemia.
B12 deficiency.
24-hour urine.
24-hour urine collection. If there's a
For the
presence,
kidney, there's proteinuria.
yeah, that's another story. That is the creatinine clearance.
Yes, screening, yeah.
But again, there's a lot. Like for example, the VMA test is another 24-hour. Okay, but not limited to a certain topic only. But that's a good point. Creatinine clearance is for what? For kidney. Okay, last topic. They are asking about what is the pulmonary embolism. Okay? Pulmonary embolism, meaning to say, isem, there's a blood clot. Is this an emergency? Yes, ma'am.
Yes.
This
Yes.
is an emergency. Okay, take a look with what? Take a look with the chest, right? Same thing with the path embolism and another emergency. Take a look with what? With the petechiae where? especially with the path embolism, petechiae in the chest. Okay? Next topic. We're almost done. Leukemia. Okay? They are asking about leukemia. Leukemia is cancer of WBC. Almost 100,000 up.
Like abnormal
Okay?
count.
Yeah, very good. Okay, leukemia. There you go. So pretty much they are immunocompromised. Immunocompromised. And then they are asking how to take care of a client undergoing radiation therapy. Okay, if you're going to be inside, you have to limit the visitor and limit exposure. And then you have to what? You have to wear a dosimeter. So the dosimeter is pretty much what? The dosimeter is a what? To what? To gauge your exposure. Dosimeter. Okay, next. Can I, what? This is a lot on this topic. Can I clear?
Hold on.
Okay, go ahead.
Okay.
Okay, so we're good. Next topic. We're almost done. Next topic is study. Okay, polycythemia vera. Polycythemia vera is a cancer of what? Of RBC. Everything is down. And of course, ruddy complexion, meaning to say they are very red. Ruddy complexion. Red. Okay, next topic. Next topic is what is, hold on. Ostomy, hypothyroidism, diabetes. Diabetes, the hyperglycemia, and the hypoglycemia. Okay? Okay, what is the signs and symptoms of hyper? Hyper, of course, the 3 Ps. Right? So, polyuria, polydipsia, and polyphagia. What will you do with that one? We have to administer insulin and check the blood sugar. Hypoglycemia is the I'm tired. Okay, I call it I'm tired, tachycardia, or I call it tremors. Okay, and then followed by I, irritability. And followed by R, restlessness. And followed by E, excessive hunger. Okay, and followed by D, diaphoresis. Okay, so I'm tired. What to do? 4 ounces of OJ. But in ATI, remember this one. They love the 12 ounce. 12 ounces of skim milk. I remember that one. 12 ounces of skim milk. Okay? Because if it's not a 12 ounce, my dear, do not give it. Go to the 4 ounce. Now, if there's no 4 ounces of OJ, you have to pick something. Okay? And then we have to administer glucagon if they are what? Unconscious or unable to swallow. Oh, there's a 22. If worst come to worst, there's a no 4 ounce question. But there's a candy. Okay? Or a sugar. Pick that one. And then regarding the candy, I think the candy question, the patient will what? The juvenile, the type 1, will go running like a marathon. Right?
Yes.
Part of the intervention. What to give aside from monitoring? You have to give a candy or a chocolate, a small chocolate one. Right? Not to give orange juice or bagel because they cannot put the bagel or orange juice in their what? Jogging pants. Right? So, of course, candy is the best one. So, we're good. Pretty much, this is the coverage of one topic. This one, I'll show it to you. Okay? So, again, I'm just trying to help you, but not limited. Still, you are the one who will make it happen.
Miss
Okay?
Mary Jane,
Yeah.
can I see the bottom one after the skim milk. What is that word?
Oh,
I can't see.
glucagon.
Oh, glucagon. Okay.
And then I will try to research more during the Saturday, Sunday. Okay, so that on Monday I can give you something. Okay. So pretty much for now, you follow my instruction. You follow my instruction, and then on Monday I can give you another what? Okay, do we have a time to do the lab, or do you want to do the on Monday?
Monday.
Monday. Okay, this is what we're gonna do. We'll do on Monday first, and then review.
So
Okay, you have to wear your scrub suit again, okay? What is that?
Okay.
What is that?
We have to.
Hey, Miss.
Today?
Yeah. Go ahead.
This is Lynn. Is anybody doing labs today?
No.
She just said we're gonna do it on Monday.
We're gonna have another review Monday, and then what we're gonna do labs
We're gonna do labs before the review.
Yeah.
at 5 o'clock.
Yes,
Yes, ma'am. 5 o'clock on the dot. Are we good?
Miss Mary Jane had a.
Yes,
Be fair.
$5 each question. $5.
I got 250.
250.
So Friday, tomorrow class? No.
No.
Do we have class tomorrow? No.
Monday.
No.
Monday.
It's on
You know,
Monday.
no, why I say that because I saw we were Mississippi right Monday, Thursday, and Friday.
No, they change it. We change it.
We
Oh, she
changed
changed
it.
it?
You were.
I'm
Yeah.
lost.
She was washing dishes.
She was washing dishes.
Yes,
No.
Okay.
So you know right now the answer, Miss Mika. Okay. So washing the dishes, right?
I have a
Okay.
question regarding the labs. Miss Mary Jane, when I go to present my labs, is it okay if I share my screen? Because I did like a PowerPoint since it's in relation to catheter and female.
Yeah. Okay. Yeah.
Got
So
it.
very good with that. Okay. So
Yeah, that my
pretty
question
much
was only on the labs.
5 to 6 p.m. is the lab, and then review again. All right. Actually, I want to do, if we have a time on Monday, I want to show you the COVID simulation. Okay. If we have a time on Monday, COVID simulation. Actually, I'm doing that one before when the COVID is after, I think March 17, March 16. So we did that one in one university. We have to educate everybody about the COVID-19. It's a simulation. Okay. But since you don't have any idea about that, I want to show you about the COVID simulation. Okay. It's very easy. It's 15 minutes. It's 15 minutes. You know, but again, with the lab, direct to the point. Maybe we can do one with the lab. Who are ready? Group ready? Mubo, Miss Mubo.
Wait, we had to do it in a group? I did mine by myself.
Oh.
I know, right?
I don't know if my group members are ready.
Can I give mine?
Okay, Miss Alex and Mika, are you ready?
Yeah.
Okay, so what is your topic?
How to administrate eye drops, ears, and peel.
Okay, I'll give you, this is very easy. I'll give you the floor.
Oh, now? Okay.
Yeah, now.
Oh,
You told me you're ready. I heard about that. We're ready. We're ready. Okay, go ahead. Yeah, at least we do something with the lab because I need to document as a teacher, right? I'm just, you know me. I'm just following whatever you want. You want the review? Okay, I'll give you what you want. Okay, go ahead. Lab.
Okay.
Oh, wait. It's kind of hard because, I mean, it's a hard setup. Okay, so what do you want?
Let's do ears first.
Okay, go ahead.
Do I explain it? Okay. To start, we need to make sure that we have the right patient, medication, the time, and the route. So we gotta check 6 factors. First, obviously, we have to do hand wash. Then we need to drop room temperature. The drops they need to be on room temperature. And
Patient has to lie down on the unaffected side.
okay, so for example, You gonna be my patient?
I'm gonna be a patient.
She's gonna be my
Go
patient.
ahead. Demonstrate. We will give you the floor.
My table is my bed, so I'm just gonna.
So this is the affected side.
Okay.
And this is my towel. And this pen are my drops.
Okay.
I'm gonna have her, my patient, lay on her on the unaffected side. Pull that ear up and back so I can open the canal.
For the adult.
For the adult.
And back. Okay.
Yes,
How
for
about
adult.
for the child?
3 and up.
3 and up is back
and back.
and up. And for
3
3 and down is you pull it down.
Back and down.
Back and down. So you can open the ear canal. Then you have your eardrops, and then you aim half an inch away from the ear and make sure it goes inside. You can use your fingers to open the rest of the ear and bring it in. You let the patient lay down like that for about a minute or two. And if you have a cotton ball, you can place it
if indicated.
If it's indicated, so the medication could stay in, and then you got to come back no later than 15 minutes to remove the cotton ball.
Okay. All right. Any question about how to administer what is that? Ear medication.
Ear
Okay.
medication.
The highlight, if it is adult.
Oh, if it's adult,
Up and back. Up and back.
Up and back. And
Child.
if your peds is
Back,
back
down.
and
Down and back.
Okay.
down and back. Yes.
All right. Now, what else is your next topic? Eye medication.
Eye drops.
Eye drops. Okay, go ahead. Make sure you have to have wash your hand, okay?
Yeah, after you're done.
Okay, and then make sure the tip